everyone. I'm Natalie Shurtleff, Associate State Director of Advocacy and Outreach with AARP Connecticut. So, welcome to another episode of Coffee and Tea with AARP Connecticut, where we talk about issues important to the 50 plus here in Connecticut. So, today I am joined by AARP volunteer Barbara Munck, as well as State Representative Mitch Bolinsky, who serves as the ranking member of the Aging Committee. So before we get to our questions with Representative Bolinsky, I'm going to give Barbara a chance to say a few words about herself and her role with AARP Connecticut.
Well, thank you, Natalie, and thank you, Representative Bolinsky, for joining us today. I've been an AARP volunteer for 9 years. I started as an advocacy volunteer, but I also present our Caregiving Fraud Watch Network program, several others, as well as moderate our Webinar Wednesday programming. I've had the pleasure of testifying before the Aging Committee on the caregiver tax credit legislation this year. And I also serve on our executive council with AARP.
Thank you, Barbara, and thank you for all you do. I know you do a lot of incredible work with AARP Connecticut. So, Representative Bolinsky, I believe you've joined us before on Coffee and Tea, so welcome back. But before we dive into today's topic, do you want to remind our viewers a little bit about yourself and your background?
Sure. Thank you very much, Natalie. I appreciate it. And Barbara, thank you also for being part of my host committee this morning. But I'm Representative Mitch Bolinsky. I have spent 14 years in the House of Representatives, 10 of those or 12 of those years in the Aging Committee, and recently I've been acting for the past 6 years as its ranking member, which is sort of the co-chair seat for the minority party. But the really cool thing about the Aging Committee here in the Connecticut General Assembly is that it really is what I would consider, and what I think everybody on the outside can see easily. We are really a very nonpartisan committee. We don't even talk about things as being bipartisan, because the bipartisan label sometimes seems to be overused in ways that don't necessarily represent true nonpartisan work. But what we do in the Aging Committee is remarkable, and a lot of it has to do with agenda-driven items that we get from AARP and other advocacy groups, as well as stakeholders, even in the private sector. So the work we do truly is 360 degrees with complete visibility of how it impacts not just the older citizens that we're legislating for, but it's also considerate of the impact that it has on businesses, on other government functions, on our even things like our local governments and business environment and things like that. So we have this really great reputation of passing only good legislation. So and we do that with the help of this incredible army in red, which Barbara has been up at the Capitol with us more times than I can count. Natalie is a constant presence. There's other folks that are running around in the background that pull a lot of the strings up there. Like John and Nora, but everybody there works together in such a really unified, purposeful way. It's very, very refreshing to see in the days of government being a little bit less than friendly and considerate on the national level, especially. So we, I think, are the epitome of what people really want when they show up to vote. And I credit, folks that aren't with us here today, particularly my Democrat House and Senate chairs, Jane Garibay, Jan Hockadell, we literally surround issues from, personal history, from constituent requests, and in ways that are deeply, deeply caring, which has actually made it quite easy. I don't want to make it sound easy, too easy, but when we pass bills, we pass them with stakeholder agreement, and we get unanimous or almost unanimous support on just about everything that we decide to make an initiative. I'm so proud to work on this committee and, use my life experiences and draw from the experiences of, folks like Barbara and, and just do the people's work. So
As a volunteer, we most definitely appreciate how we're received on your committee. We really feel as though we are listened to. Connecticut recently wrapped up the 2026 legislative session. AARP was excited to see many important pieces of legislation make it across the finish line. One thing that stands out is the caregiver tax credit that was introduced by the Aging Committee. Can you talk a little bit about how that tax credit will support family caregivers?
Well, yeah, the that particular piece of legislation is sort of a footnote because it wasn't part of a bill that we had actually passed this year. It came in a prior year, and it was at the time that it was passed, it was not necessarily funded. And when I say not necessarily, let's just say it wasn't funded. So we had this great piece of legislation and no way to enact it. Well, through the really hard work of folks on our committee and, the collaboration that we get when it comes to following up on legislative issues that are important to all of us, we were able to get the caregiver tax credit included in a bonding package this year. So it's going to have ongoing funding. And that news is so new and was somewhat unexpected because it wasn't part of a bigger piece of legislation that we sort of have the cart before the horse on this one because we will be supporting this, but we don't have the mechanism yet to apply for it, which is in process right now. But we all enthusiastically supported this funding, and what that does is it activates a caregiver tax credit that was passed in 2025. It's primarily targeted at lower income residents, but funny thing that happens when you're a caregiver is even if you have significant assets, you become a lower income qualifier simply because you have probably given up your work to take care of your significant other. So the credit's going to provide about a 50% reimbursement on qualified costs for home modifications, health aid assistance, and other caregiving responsibilities for folks that have individual incomes, AGIs reported at 50,000 or 100,000 for a couple, which, as I said, is a far broader audience than it sounds like, because the sacrifice of being a caregiver means that many folks don't work anymore outside the home.
Yeah, our polling showed that a significant number of people either stop working to become family caregivers or reduce the number of hours that they're working or go to part-time. And so those things all can lower their income. And so I think that this will truly have a big impact on those that need it most. So thank you for your support of it.
It's a huge game changer. It's totally my pleasure, and I know that our committee shares in the pride of this because being a caregiver is not an easy thing. I'm a 10-year caregiver. myself, and I shouldn't say myself because it was our whole family, but 15 years ago, we first took in my father-in-law, and we were a caregiver to him until we could no longer handle the task. But he lived in our home for about 5 years. And at the time, there were no supports. So everything that we did came out of the hours of our other scheduling. Both my wife and I, Louisa and I, we sort of each had assigned shifts. I was the morning caregiver because I had a later job, and Louisa was always the afternoon and early evening caregiver because I was stuck up at the Capitol or something like that. So, but we made it work. But during the process, there was a significant expense that we bore in doing modifications even to our home to be able to accommodate my father-in-law's walker to get through the bathroom door threshold. Simple things like that will now be part of a program that's covered, which is incredibly helpful to somebody that needs to focus more on the caregiving and less on how the heck they're going to pay for it all.
Well said. So beyond the caregiver tax credit, I know the Aging Committee also passed several bills through the legislature. So can you share some of the highlights and what you're most proud of?
Well, we had a pretty good record this year again. It was a short session in Connecticut for those folks that don't understand what we do at the Capitol, which is just about everybody, including sometimes me. We run. We're a part-time legislature in Connecticut. We work part of the year in even number years. We do something called a short session, which was this year. It's a 4-month session. And then everybody hits the campaign trail after that. So it's condensed. It's very, very high pressure. And there's a limited number of things you can focus on. So we don't usually go huge in the short session. And then in the odd number years, we work a little bit over 6 months. And that's where we do our real committee work and actually submit personally, favorite or preferred or, necessary bills that come from us that may or may not be this committee's related. I usually submit about 30 different bill concepts at the beginning of a long session and try to work our way through that kind of stuff. So we are a part-time legislature with full-time responsibilities. But like I said, we have this thing going in the Aging Committee where our reputation is such that we don't pass bad bills. And we don't go taking pieces of budget money from other initiatives or other committees. We work everything totally clean. So this year we passed 3 bills out of the House of Representatives. Unfortunately, one of them didn't make it through the Senate, but we did get House Bill 5142, which was something that's a permissive bill to encourage the use of virtual monitoring and visitation for families that want to keep an eye on their loved one when on days they can't be there. So the bill itself started out as being something that folks had concerns about because nobody wants a camera in their room if it's not their camera. So the entire issue was made into one that was permissive and requires written consent and all kinds of different carve-outs to make sure that privacy doesn't become an issue for somebody's roommate. And the bill passed unanimously. So, and it went through the Senate unanimously, and we expect the governor to sign it any second now. We also passed an act requiring homemaker companion agencies to raise their training standard to be similar to that folks would get in a hired nursing facility as well. We've seen this huge proliferation in homemaker companion type agencies, which are not necessarily healthcare agencies. They are companion and, housework and, day-to-day chore type of support for individuals that need the care if their family can't be at home all day. So, and that was House Bill 5143 also passing unanimously. The bill that we lost was a very important bill to our healthcare community. We will bring that back next year. And what it simply did was it allowed the practice of dental hygiene and oral health exams in the home of somebody that does not have the ambulatory ability to go to a dentist on a regular basis. And since, our overall health is something that usually manifests itself very quickly in our mouths, regular dental visits and dental hygiene usually are incredibly important to spotting early warning signs of different types of health problems. So that bill is actually one that in the long run will probably save the medical system and governments hundreds and hundreds of millions of dollars in finding things before they become problematic and require more acute treatment. So, and then the bills that came from the Senate, we have Senate Bill 123, which was an act requiring public hearings for assisted living facilities that are raising their rates by more than 10%. We wanted something a heck of a lot bigger. We wanted to, have some sort of a regulation, on really private equity in many degrees. So we couldn't get the regulatory thing done in a short session, and there was an awful lot of dissonance coming from the industry, and we did not want to set a bad precedent by shoving something that wasn't ready into prime time. So instead, we defaulted this down to having nothing more than a public hearing in the case of a large rate increase, so that people get a chance and their families get a chance to be heard and to try to understand just exactly what's happening, because there's been an awful lot of escalation in the rates of caregiving, particularly institutionalized caregiving, over the past several years. Since the pandemic has begun, it's meteoric how much more it costs, and it's something that we need to get a handle on. One of the ways we get a handle on it as a committee, though, is supporting aging in place, right? Because we believe, as AARP believes, that the best place for anybody to age is amongst the people that love them in their home or in a relation's home. Coincidentally, as far as insurance and government and all the rest of that go, costs about 1/3 as much to have somebody in home care, even if we provide the necessary services to support the caregivers, than it does to put somebody into a what I'll call an institutional setting. But nursing homes are the most, in my humble opinion, the least personal ways of care, and most certainly the most expensive. So aging in place is really where our heads are at. But in the meantime, we want to also get a handle on what's happening in the private sector as well, and for people that need a higher level of care. And that's also sort of the theme of Senate Bill 125. It actually does speak about initiating an act, in this case, to fully study sort of what's happening in the world of private equity, because as facilities become more expensive to operate, we want to understand the dynamic that happens when private equity is involved, because we've discovered very clearly that there's a such thing as a good owner and a bad owner. We want to understand that and find out if the common thread has something to do with a particular nuance of private equity that we can possibly soften or regulate to the point where we don't necessarily have business decisions that don't put care and the continuity of care at risk. So it's very, very important that we allow people to move through the continuum of care, smoothly, because somebody that is aging in place at some point might need a higher level of care. We want to be sure that what they're getting is definitely worth what they're paying for it and reliable. And that's those are our basic fundamental things that we worked on very, very hard to get passed. We got 4 of the 5 through both parts of the legislature, waiting for signatures from the governor, and the 5th one, the dental hygiene bill, which is important on a lot of other levels. It will be back because it's very, very important across the healthcare spectrum, and we were actually asked to get involved in that by the Department of Public Health, or by the Public Health Committee, because they were not necessarily having the success in bringing the parties together that we were able to do. What hung it up was just a little bit of political theater in the Senate, and we think that when it comes back next year, that we'll be greenlighting it.
Great, thank you. During the legislative session, many AARP volunteers, myself included, show up in Hartford in our red shirts, our scarves, to advocate on these important issues. What can you tell our listeners about how they can make their voices heard?
You know what? Earlier I referred to AARP as the Army in Red. We on the Aging Committee depend on you being there. So we don't just welcome you. We know that you're part of the entire equation there. It is so important to see AARP's volunteers, in committee meetings, in public hearings, at the time that we have important votes on the floor of the House or the Senate, because it's a continual reminder that America's population is aging. We all are living longer. We all have particular needs, and the easiest way to deal with all of our needs in the healthiest and most cost-effective way is through preventative type programs. And AARP is one of our barometers for just exactly, what the greater population is finding that they need to ask for. So when AARP shows up, not only do we listen, but the entire building and legislators that have nothing to do with our committee, it's hard to overlook that army of red-shirted volunteers that are always there and always kind. And anybody who's listening who thinks that these are important issues, which is probably all of you since you're listening, you should get in touch with AARP and think about being a volunteer, because these guys, you guys, are welcome at the Capitol. We depend on your advocacy to move some major issues, and it's largely because of the support we get from you that we in the Aging Committee have the luxury of passing bills with such strong unanimous or near unanimous support. So what you do matters an awful lot.
Well, thank you. I know it's for volunteers, it's very meaningful that we know we have your attention when we do come up there. Is there anything we have not covered that you would like to share with our viewers?
Just to make sure that your voice is heard. It's terrifically important to not assume that the other folks that live with you in your community know your needs. So a lot of initiatives that happen in communities that separate communities that are great places to age happen on the local level as well. So you'd want to be involved with your local department or commission on aging. Here in Newtown, where I live, we have a very active commission on aging, and we also have a 100% volunteer army of our own here in Newtown called the Friends of Newtown Seniors. And it's more than just a nonprofit. It's a completely volunteer run advocacy group, and they are everywhere as far as putting together programs, lunch and learns, things that stimulate interest, but also get, seniors together talking about what their needs are. And you'd be surprised at anything that you think is important out there. There's a couple million other people that also think that that's important. So talking about it gives it life. You want to give legs to an issue that matters to you, find a couple million common people to share it with, and then, bring it to your local town government, or bring it to the state government, because, in a group that's organized and always nice and always productive in the way they work, you guys are a pleasure to listen to. So we hear you, and we respect your advocacy more than any of us can actually express.
What a great note to end on. Thank you so much. And I'll use this as an opportunity to remind our viewers that you can scan this QR code to become an e-advocate and send messages to lawmakers like Representative Bolinsky and make your voice heard in that way. And you can also find out more about becoming a volunteer with the AARP and joining our Red Shirts, our Red Army in Hartford, to help pass all of this incredible legislation. So I'll end by saying thank you to both Representative Bolinsky and to Barbara for joining us today, and having a really great conversation about some of the things that the Aging Committee was able to accomplish this year. And go ahead and join us again in 2 weeks for another episode of Coffee and Tea with AARP. And you can view all of our back episodes on YouTube and Facebook. And we'll see you again in 2 weeks. Thank you.